Nathan, it's good to see you again. I think the last time that we spoke, it was in person in Austin, and it was pre-COVID-19. Actually, it was the very beginning of February, before this was even really being talked about. A lot has happened since then. What's going on in your world?
Well, thanks, Rip. It's good to see you, even though it's virtual. But yeah, we're living in a certainly different time than it was when we met face-to-face for the podcast. But here's what we know, 4 months into this COVID pandemic, is that, it is a serious virus. But what we're recognizing is that there's certain populations that are more vulnerable to infection, and that happens to be the African-American community. And the data to me are really clear, because there's been known health disparities in the African-American, even Hispanic population now for probably 50, 60 years, and no one's addressed it. And now it's becoming very apparent with the COVID pandemic, because African-Americans seem to be more susceptible to infection. Their rate of hospitalization is, 5 to 6 times higher than any other racial or ethnic group. The severity of disease seems to progress much, much more rapidly. And then the risk of death is anywhere from, some reports it's 4 to 6 times higher risk of death. Sometimes it's, some reports are showing 10 times higher risk of death from African Americans. So here's what's relevant for what we talked about months ago to now, is that the health disparities of African Americans are due to lack of production of nitric oxide. And we know now that people that have comorbidities, or really symptoms of insufficient nitric oxide production, are the ones that suffer the worst severity of disease, hospitalization, and death. So now we have a clear mechanism, Rip, of why African Americans are suffering from this, as well as Hispanics, but we're really focused on the African American population. And now we have ways, and we're actually investigating this. So we'll keep in touch and keep you tuned to this. But to me, this is very important, because no one's addressed the health disparities of African Americans, despite the fact that we now know a mechanism of action, and it's loss of nitric oxide production. And now we have a chance to intervene and address this very vulnerable population at a very important time in our lifetime.
Yeah, no, that's very exciting and very timely. Do you have any thoughts on what it is that makes the African American demographic so vulnerable?
Yeah, it is. It's genetic and lifestyle. So there's a known G6PD deficiency in African Americans. It's about 10 to 12% penetrance, where in other populations it maybe is less than 5. There's salt-sensitive hypertension that seems to be more prevalent in the African American community. And a lot of it's lifestyle, it's diet. And so all of those, both from genetic, epigenetic, all the way down to physiological response to these environmental and genetic factors, really makes them more susceptible to infection, and the severity of disease progresses really, really rapidly. But most importantly, it gives us a chance to intervene and understand this from a mechanistic standpoint, and really help this population of people.
Let me just sign out with a new sign off, which is peace, engine 2, nitric oxide.
All right. Thanks, Rick.
I want to thank Dr. Bryan for his groundbreaking and dedicated research for the last 25 years. When cells can't get oxygen, organs and tissues fail, and that's the basis for most disease. But by following some of the advice in this episode, you can reverse this trend and turn your body into a nitric oxide machine. And if you're one of the millions of Americans who rely on antacids, antibiotics, or fluoride on a daily basis, know that there is a better way. There's no prescription or medication that can overcome physiology, and once you restore nitric oxide production, everything works better.